So, you know, the first thing is that you've ground away, you know, a fifth or a fourth of the tooth structure. You've exposed a lot of dentin. You've stressed the tooth. If you didn't use a lot of water spray, you heated it up. If the tooth had deep caries, we've gotten close to the pulp, exposed it to the bacteria that we've been cleaning out. So at the point that we're ready to cement a crown, you need to make sure that the tooth is comfortable. Patients will many times come in assuming that the reason it's been sensitive since the last appointment is it's got a temporary on it. And they think as soon as you cement the crown, it's going to be comfortable. So don't just assume that they're going to tell you about problems. Make sure you discuss the issue with them, that, you know, the tooth should have been comfortable. It's not comfortable. We probably ought to wait. But if everything's been fine, then we're going to go ahead with the next step. So we'll remove the temporary. I don't say anything about local anesthetic here because that's optional. You know, if the patient feels like they'll be more comfortable with local anesthetic, then you can go ahead and give it. Most people are willing to try without it. And I'd say 4/5 of the time or so, you don't need the local anesthetic. You're going to be drying the teeth, but as long as you warn them before you blow air on it that it's going to be sensitive for a second, you know, as long as you don't just surprise them with things. Usually it's not a traumatic experience to cement it without anesthetic. It will allow you to check occlusion better. The patient will be able to go home and use their new teeth to eat dinner that night without being numb and chewing up their lip. You know, so it's safer to do it without the anesthetic if you can. So we remove the temporary. You'll generally take a 2x2 gauze, and I forgot to bring that, but that's okay. You know, just take the corners, spread it out, use it as floss to clean in between, use it to scrub the tooth. It's just a quick and easy way. If you read the text, if you read anything about it, they always say pumice the tooth. The problem with that, it's going to make the gingiva bleed. It's going to round your margins. So I don't like to do that at all. I would much prefer to just take the gauze and clean it. And then if there's something that won't clean off, you have a little proximal tympanoid or that sort of thing, you can get it with a explorer and scrape it out. If you have an MOD, you're almost certainly going to have to get into the line angles and clean it out. One of the reasons we use the Tucker technique for inlay cementation is there's no cement to clean out. So if you're looking for perfect margins where there's no residue of temporary cement, you don't ever put temporary cement in there. So you have a temporary that leaks, but you have something that doesn't interfere with the cementation. Okay. So we've gone through the steps of cleaning it off. You've got the preparation on the tooth. You've got the gold crown in your box, or the PFM more likely in the clinic situations, and you're going to try it in. It's wise to take that 2x2 gauze, open it up, and just lay it in the back of the mouth. Lower's usually not too much of an issue. You can sit the patient up, but if they swallow the crown, you go take x-rays to see it went into the lung. And so it is an issue that when you're nervous and the patient is kind of new to you in terms of manipulating things, it's very easy to get in there and have them swallow right then and have the crown disappear. You go, where to go? And if you don't know where it went, you've got to find out.